So, doctor, can you please provide me with an overview of the IBH model and its objectives? And how do you think that the IBH model will impact the overall quality of care for individuals with mental health conditions and or substance use disorder?
Sure, and thank you. I think it will have a positive impact. I do think that there's some things that we need to consider, and so just providing a brief overview. Um, the way what's intended is that there's an expectation to include mental and behavioral health professionals in the in the care continuum. And the thinking behind that is, I know the statistics that they cite are, 40% of Medicare patients have, or excuse me, 25% of Medicare patients have some behavioral health or substance use disorder that needs address that would impact their health outcomes, and as much as 40% for Medicaid. I would probably even argue that for both of those, it's probably much greater. But the thinking is that no matter where the patient comes into the care continuum, that they have access to behavioral health services. And I think it's a nod to understanding that mental health is so important to one's physical health, and that unless you are addressing those issues, difficult to have an impact. But it behavioral health professionals as part of the care team, and I think that there were some changes that were made around these professionals being able to submit claims to CMS, as far as like scope of practice and licensing. And I believe that, this was all in anticipation of going large with this model, because we know that it's going to be an 8-year program that's being supported. But in that first year is when CMS is going to work hard to try to bring these healthcare professionals, these behavioral health professionals, into the mix so that we have adequate care. Um, yeah, and there's also some discussion around for those professionals, just to make things easy or easier, providing funding, support with technological resources. I definitely, just in the cursory read that I did, I definitely think that there will be thinking around, interoperability, telehealth, and using, different types of technology in order to prove access.
Can you also just because now that you've mentioned technology, can you also mention what kind of technological needs do you think that they should definitely work on improving for these people? And also, what other resources and what other technological resources they can use?
That's a great question. I think in addition to having like access for telehealth, I think being able to bring in data, I think data is going to be so important. Not only, health data, say from past visits, but I think knowing prescription information, or knowing, how many visits this person has had. Um, One of the things that they acknowledged too was that a lot of times, and one of the reasons for this program was to put in programs that would help address things like inappropriate use of the ER, right? Because the emergency room should not be a place to treat mental health. Though, unfortunately, right, a lot of times folks access the emergency room when it's kind of, you know, um, I think it's the last resort, but that's where they know to come to get help. It's escalated to a point where, that's where they feel that they need to seek services. And so if there's ways in which we are informed ahead of time, and so by having that data, right? So, uh, our accurate capture of social determinants of health data, because we know all of this goes into contributing to the overall wellness of an individual, would be really important. And I think, I was just reading an article separate from this, but just about the importance of epigenetics. And so a lot of times, we think about mental health and providing services or supports for that, and we look at overall healthcare. And what we really need to think about are the environments in which people are living, and even the care that they seek. If they seek care at one space and then are going back to the environment from which they were in, that probably caused the exacerbation in the first place, or there's something in their background or their environment that's contributing to the place where they are, it's going to be very difficult to disrupt what's going on otherwise. And so I think that we talk all the time about interoperability and data, but I can't stress enough how important data will be. And I think all different types of data. So again, not just claims data and encounter notes, not just pharmacy data, of health data, whatever's available to you, that you're able to bring together to really have an accurate portrait of that patient. I think our work is only going to it's going to be more complex. It's going to be much more difficult, especially with the systems that we have today. But I think that if we really see this come to fruition, it'll be a lot better. I just think that there's a lot of support that needs to be given in order for this program to be successful.
That is an excellent point, Doctor. Thank you for sharing that. The model also emphasized on whole person care. And how does this approach address the
Yeah.
historical silos between physical and behavioral health? What do you think about it?
There are silos, and I think that it's all about this interpersonal care team, and the thinking is that when you come across a patient and you find that they need behavioral health needs, or maybe they need, access to, say, food or transportation or other types of need like that, or, maybe it's referring a patient to a physician because, in their behavioral care, in their therapy, there's something else that's discovered. So the thinking is that wherever the patient comes in, that they'll be referred to the appropriate places. Historically, there have been silos. I think that CMS is doing a lot with just the changes that they've made around including other types of, I guess you would say, allied health professionals, including them in the mix, allowing them to submit. Um, but also, too, I think one of the things that's technology that can alert you to the resources that are out there, how to make referrals, and how to connect all of us. Because I do think that there's been silos. I think that they've been seen as separate entities, and not to offend anyone, but I don't know that I think a lot of times the different practices have different ways of addressing challenges. And I don't know that every behavioral health concern needs addressed through, say, a pharmaceutical. And so I think that there's, therapy and other ways at getting at things that would be more beneficial for a patient. And so knowing when to refer, knowing how to refer, and you know, there's professional particular things. And so I would say, for physicians, to, behavioral health, and even therapists can differ in what's necessary and what's needed. Um, so I do think, to your point, that there's silos, and that's why I think that there's a lot of work to be done and there's a lot of complexity. Knowing what resources are out there, and then what's the protocol, what's the process for making the referrals that are needed.
The model is actually set to launch for 2024 fall. What do you think some steps should be taken by healthcare providers and organizations to prepare for its implementation? And also, can you provide insights into the anticipated challenges during the 8-year operation in these 8 states that have been mentioned?
Yeah, right. So whenever I think of the work that we do, I know I've talked about this before, but I think of like the three. I definitely think that technology will be important. So having platforms where you can bring all of that information that I had mentioned together at the right time, right? And having it at the point of care, being able to make referrals, so important. Technology to be able to improve access to care too. And so maybe that's expanding telehealth. Trying to think what else. Those would be the immediate areas that I would think about. The other thing then would be providers. And so looking at your workflow, working at your processes, um, are your teams in your office and not just your physicians, because you have people all throughout your office that are interacting with patients, but are they aware of what they need to do, how to make referrals, what the process is or the protocol is for getting people in touch with the resources that are necessary. I would also say that uh, there's an opportunity to reach out to and align yourself and network and make relationships with behavioral health providers. Maybe there are folks that, depending on how your organization is set up, that you might want to bring on team. But what are you going to do? How are you going to make those referrals? How are you going to make sure that that voice, right, and that expertise is included in your panels when you're discussing patients, and so that you can make appropriate and adequate referrals. And then I would say that there's even an onus on the patient. And I just came from a conference where we talked about that there's a need a lot of times to educate patients on their benefits. And so I think that, there's a call for communication, letting patients know what's available to them. Also, too, I think we need to break down the stigma that's associated with behavioral health. I think we've come a long way, but I don't think that we've come far enough, and even on those social needs. So making patients aware of, their access to, say, benefits such as, food or transportation or flex cards to help with medications and things like that. Um, I think that there's an opportunity to share that and make patients um, informed consumers so that they also too can own their healthcare, have more agency, be more empowered, and I think interact at a higher level. I think is important. So those would be the things that I would suggest practices and group systems, right, start to look at, if not already. Those would be areas that I would develop in. As far as the challenges, I think, I would enumerate all three of those things that I just said. I think that if you're operating on old systems or you're operating on disparate systems that can't bring data together at the point of care and all of this data together, that's challenging. And so would advise you to look for ways in which you can evolve and improve, modernize what you're doing today. Would also say, as it relates to providers, I think that there will be a shortage of behavioral health providers. And I worry anytime that you encourage and try to recruit that you still need to make sure because behavioral health I think is just it's a difficult area and you want to make sure that you have competent professionals that are seeing patients. And so making sure to do your due diligence in who you're choosing to partner with, making sure, really thinking through what are all the use cases um, and ways in which paying to plan for that. So really thinking through the process, doing that task analysis of the work that needs to be done, just to make sure that you're referring to the appropriate agencies and that patients are truly getting the support and care that's needed when they're referred to those agencies, or if you're choosing to add right to your staff. That you're doing your due diligence and that you are sure that you have competent and the right level of competency, on staff. There's different levels of providers there, and so you want to make sure that you have those with the appropriate resources to help the patients that you are seeing available. And then, around patients, there's a stigma with behavioral health and mental health and even social needs. And so, having those types of discussions, a lot of times the typical office doesn't allow for that. You know, uh, quiz visits are often quick. And so, to the extent that you might even consider, and maybe it's a non-clinical professional that you have in your office, but that's spending time making those connections, developing those relationships with patients, so that, they too can support that process. And I think education for everyone will go a long way, and letting patients know that, it's okay. They're not alone that behavioral health challenges, these social challenges are probably more common than folks would like to believe, but that there is help. And so knowing, how to access their benefits, knowing what services are there to support them, and then removing or reducing that stigma that's often associated when one accesses these types of services. The only thing I was going to mention is that I've worked with a lot of groups where they'll forget to tell the front office staff or someone who's answering the phone. And, and then that information doesn't get carried through to that person. And that often is the person that's spending the most time with the patient. And so it's really important to make sure that not just your clinical team is educated, but everyone in the office needs to be aware, in every organization of the different programs. Maybe it's a different level of knowing, but they still should have some awareness because oftentimes, right, they're interacting with the patients or there might be other things that they're working on and doing, and they should understand how the parts fit into the whole.